would include the kind of chronology of this patient's symptoms, in particular with interest to this bilateral cellulitis that's been mentioned. I'd want to know the area that's affected, whether it's the upper limbs or lower limbs. I'm assuming it's the lower limbs in this case. I'd also want to ask about systemic features. So are they systemically unwell? I want to ask about things like, fevers, any signs of, if they've got any rigors or systemic infection alongside this UTI that they've got. And I would also kind of want to know sort of if in their past medical history, they have any predisposing features to cellulitis.
And it's really important to rule out a secondary cellulitis and a secondary infection. So Manpreet, your history, key history features were key, and the questions you asked were really important. Is the patient febrile? Are they having rigors? Are they unwell systemically? If you have a good going cellulitis, you will have systemic symptoms, okay? The next thing is investigations. What are the inflammatory markers? Do they have a documented fever? Again, these are really important to distinguish whether they have a cellulitis as opposed to these changes. In terms of investigations and management, that was excellent. I would always swab if there's any oozy, wet.
And I think that's a very important thing to try and nail down for your dermatology application at ST3 level, because there is nothing like doing a rotation in dermatology itself to give you the necessary clinical know-how and to be able to speak their language when it comes to the interview. Yeah. And it does help that you might know the consultants, and you might know what it is they're looking for through actually working in a dermatology department. I think prior to that, I was also very fortunate to have been an AFP in Wessex, for which I was able to do a project which then resulted in a publication down the line, which then of course helps with the application as well. Yeah. And in between, what really helped me with all my applications and scoring really high on my applications was actually taking a year out to work as a research fellow. Granted, I know that not everyone is in the position to be able to do this for lots of various circumstances, but I was very lucky to be able to do that research fellow year, which was very productive. I got to tick off lots of boxes. Sorry about the barking and things.
That's all right. So was that in dermatology?
It was actually in allergy. And because prior to all this, I was aiming for allergy, and so I did a research fellow job in allergy. Which I think generated around 8 or 9 publications, which was a very productive year, and it also gave me time because there was minimal clinical sort of involvement. I was able to tick the other boxes, for example, the leadership box, and also the teaching box, and it also gave me time to work on the MRCP. So I would highly recommend.
Think about the important negatives, but also those red flags that might direct you to a different differential. And then on the topic of differentials, so when you're talking about dress, you want to, in your interview and also in clinical practice, to be able to think of other differentials that this drug rash might represent. And an important differential to be able to rule in or rule out appropriately would be SJS or TEN, which, like I said, we will cover in a separate video, and also AGEP. So Naren, did you want to touch on AGEP? Because I know we were discussing.
Yeah, so AGEP is acute generalized extensive pustulosis, which is another severe drug reaction. However, it's not common. I mean, none of them are common. I'd be surprised if they asked about AGEP in your interview, but I think it's just good to be aware of the 3 main severe drug reactions, which is DRESS, AGEP, and SJS/TEN, which is a sort of spectrum. So in terms of AGEP, this is a very quick onset drug reaction. So in contrast, the timeline, from the medication onset